Assalamualaikum warahmatullahi wabarakatuh. My name is Putri Shasha Batrisha, and our group will be presenting about antimicrobial resistance as emerging problems. Before we go into detail what is antimicrobial resistance, we must first understand what antibiotics are. The word antibiotics means against life and is defined as medication that helps stop infections caused by bacteria. They do this by killing the bacteria or by keeping them from reproducing. For example, antibiotics kill bacteria by destroying crucial parts that they need to survive, such as their cell walls or DNA. Antibiotics can also stop the growth of bacteria by preventing them from making certain proteins that they need to multiply. Any drug that kills germs in your body is technically an antibiotic. It may take a few hours or days after taking the first dose before people feel better or their symptoms improve. Bacteria, on the other hand, is defined as microscopic germs that live inside our body, on our skin, and all around us. Most types of bacteria do not harm organisms and alternately help keep us healthy. But certain bacteria can make organisms sick, with the effects that range from a mild infection to certain death. As you can see here, there are many infections that can be treated with antibiotics. This is why antibiotics are paramount. However, when using antibiotics when they are not needed, like for viral infections or mild bacterial infections that would go away on their own, it can eventually lead to unnecessary side effects and contribute to the global problem of antimicrobial resistance. AMR is not limited to antibiotics, but also antifungals, antivirus, and antiparasitic. Most people and animals require these at some point in their lives and probably many times. While it benefits towards many organisms, we must be reminded that the misuse of antimicrobials can give harmful effects in the long run. Now, many of us are familiar with the discovery of penicillin by Alexander Fleming on September 3, 1928. While there existed other remedies that would act as antibiotics before, penicillin was deemed the first true antibiotic. Fleming observed colonies of the common Staphylococcus aureus bacteria that had been worn down or killed by mold growing on the same plate or petri dish. He determined that the mold made a substance that could dissolve bacteria. Fleming and others conducted a series of experiments over the next 2 decades using penicillin removed from mold cultures that showed its ability to destroy infectious bacteria. Before long, other researchers in Europe and the United States started recreating Fleming's experiments. They were able to make enough penicillin to begin testing it on animals and humans. The usage of antibiotic-producing microbes to prevent diseases can be traced back for millennia, with traditional poultices of moldy bread being used to treat open wounds in Serbia, China, Greece, and Egypt more than 2,000 years ago. The antibiotics years ago were administered by either applying on the body or by injections. Medical documents had stated that moldy bread and medicinal soil among its list of remedies. It was also discovered that there used to be a natural remedy that was made from onion, garlic, wine, and bile salts that had shown antibacterial potential, with promise to treat diabetic foot and leg infections. Arsenicals and sulfonamides, as well as several disinfectants made with metal ions toxic to bacteria, such as mercury or copper, were used before the production of penicillin. Now, in modern times, antibiotics are commonplace and can be found everywhere. They can also be administered in various ways, such as through oral, in the form of tablets, capsules, or liquids that treat most mild to moderate infections. Topical, such as creams, lotions, sprays, or drops that treat skin infections. And injections that can be given directly into the blood or muscle for more serious infections. Antibiotics can be produced in bulk and will hardly run out. Today, pediatricians and doctors can choose from dozens of antibiotics now on the market, and they are being prescribed in very high numbers in both animals and humans.
Assalamualaikum and greeting to all. My name is Nur Ali Fatimi binti Muhammad Asri and my matriculate number is 066277. In this section, I will go over different type of antibiotics, how they use on animal and what kind of antibiotics they are used on the animal. First of all, the majority of antibiotics belong to one of the several class. A class of antibiotic is a collection of several medication with comparable pharmacology and chemical characteristics. Drugs from the same class may kill the same or related microorganisms that have chemical structure that resemble one another. So, these are 10 primary categories of classic antibiotics, following with penicillin, tetracycline, cephalosporin, quinolone, lincomycin, macrolides, sulfonamides, glycopeptins, lincomycin, macrolides, sulfonamides, glycopeptins, lincomycin, macrolides, sulfoaminoglycosin, and last but not least, carbapenems. Next, we will look at how the antibiotics perform in animals. The first use of antibiotic is to stop, treat, and manage bacterial illness in animals. Animals can develop infections like pneumonia, just like the people can. These infections are treated by prevented with antibiotic in an economical and compassionate manner. The vast majority of livestock procedures are extremely concerned about the welfare of the animals they are responsible for, despite frequently being represented by some in the media as harsh and heartless. It is cruel and unethical to let sick animals into infection that can be easily treated by medication. In addition to being human, farmers survive and provide for their own families by making money from raising cattle and producing meat. Unwell animals are not productive, can spread disease to the other animals in the herd, and may even pass away. Providing suitable veterinary treatment for sick and damaged animals is in the best interest of farmers. Second, using antibiotics can make animals perform better. Farmers may produce more meat using antibiotics while utilizing less feed. Some antibiotics cause the bacterial colony in the rumen, one of the four stomachs of the cattle, to create more of the chemical that cattle require for growth. Some are administered as a preventive measure to shield animals from illness that are exceedingly challenging to treat once they are get afflicted. Importantly, the antibiotic used to boost production that are a group of chemicals known as inophores are not used to treat people, and when handled appropriately do not leave residue in meat. The use of antibiotics in cattle to increase productivity is no longer permitted. Instead, they must only be used for the prevention, control, and treatment of the disease. Antibiotics are more concentrated in the body for a shorter amount of time when they are injected than when they are fed to the animals. If newborn calves develop pneumonia or bacterial diarrhea, they may require antibiotic treatment. If calves with recent weaning need to be treated for pneumonia, they may require antibiotics. Bulls, cows, and calves can experience bacterial disease like pink eye or affected wound at any stage of life that need to be treated with antibiotics. Penicillin, tetracycline, cetiofur, flofenoco, tilmicocin, enrofloxacin, and tulathiomycin are some examples of antibiotics that are frequently prescribed for this illness. Sometimes these therapies are required to ensure the animal's survival as well as to lessen the misery that these ailments cause.
Hello, my name is Nik Nur Shafia Izni binti Nik Mahalim with matrix number 067609, and I'll talk about how does antimicrobial resistance, or also called as AMR, occur and their respective examples. As mentioned before, antibiotics are medicines used to prevent and treat bacterial infections. Antibiotic resistance occurs naturally, but misuse of antibiotics in humans and animals is accelerating the process. A growing number of infections, such as pneumonia, tuberculosis, and salmonellosis, are becoming harder to treat as the antibiotic used to treat them become less effective. Antibiotic resistance occurs when bacteria change in response to the use of these medicines. Increases in antimicrobial resistance are driven by a combination of microbes exposed to antibiotics and antifungals and the spread of those microbes and their resistance mechanism. Talking about antimicrobial resistance, there are several terminologies that need to be understood, especially to have a better understanding on the effect of the AMR on food safety. Firstly, the maximum residue limit, which can be defined as the highest concentration of the residue of a particular chemical that is legally permitted in the food or animal feed. If this limit exceeded its normal range, there might be an indication of a misuse of chemicals such as antibiotics. Then, there is a term called withdrawal period. It is a period of time necessary for an animal to metabolize an administered product and amount of time necessary for the product concentration level in the tissues to decrease to a safe and acceptable level. The use of antibiotics in livestock can result in antibiotic residue, which is the deposition of residues in meat, milk, and egg that must not be permitted in food intended for human consumption. So, how does antimicrobial resistance occur? When a person or an animal prescribes the antimicrobials, the medicine will only kill most of the microbes, but the microbes who have the advantages to survive will be left in the body. These microbes are known as the superbugs, in which they are resistant to the antimicrobial. The resistant bacteria can pass the DNA changes on their offspring or sometimes even to each other to generate new strains of antibiotic-resistant bacteria. Moreover, the superbugs also can be transmitted from livestock animals to humans, primarily via food. This happens when the livestock animals receive unnecessary antibiotics, leading the bacteria to become resistant to antibiotics. Then, the bacteria will travel on meat from farm to the store. Those meat will be bought by the consumer and eaten, resulting in hard to treat illness. The microbes can develop defense strategies against antibiotics, which carry many types of resistance mechanisms. Antimicrobial resistance mechanisms fall into four main categories, which are blocking entry of the drug into the cell, modifying a drug's target sites, inactivation of a drug by enzyme, and efflux of the drug from the cell. Previously mentioned, misuse of antimicrobials in humans and animals contribute to the emergence of resistant forms of disease-causing bacteria. The misuse includes using outdated or weakened antibiotics, using antibiotics for the common cold and other inappropriate conditions, uses of antibiotics in animal feed, failure to complete the prescribed regimen, and using someone else's leftover prescription. Currently, the most serious concern with antibiotic resistance is that some bacteria have become resistant to almost all of the easily available antibiotics. These bacteria are able to cause serious disease, and this is a major public health problem. Important examples are methicillin-resistant Staphylococcus aureus, MRSA, vancomycin-resistant Enterococcus, VRE, multi-drug-resistant Mycobacterium tuberculosis, MDR-TB, and carbapenem-resistant Enterobacteria CA, CRE gut bacteria.
Hi and Assalamualaikum. My name is Nurul Shahada binti Khairul with a matric number 065811. Here we're going to talk about AMR trait as One Health challenge. So One Health, what is actually One Health? It is a collaborative effort of multiple health science professions to attain optimal health for people, domestic animals, wildlife, plants, and our environment. For your information, the World Health Organization, or people call it as WHO, lists AMR among top 10 threats for global health. Antimicrobial resistance threatens human and animal health and welfare, the environment, food and nutrition security and safety, economic development, and equity with society. So, as mentioned by my fellow previously, AMR occurs when germs like bacteria and fungi develop the ability to defeat the drugs used to kill them. It is a One Health issue affecting not only people but animals, plants, and the environment. The use of antimicrobials is anywhere, such as in a hospital or in a farm, which can contribute to AMR, making infection in both people and animals harder to treat. So we're going to talk about how AMR threats as One Health. According to recent estimates, in 2019, 1.27 million deaths were directly attributed to drug-resistant infections globally. By 2050, it is projected up to 10 million deaths could occur annually. So if unchecked, AMR could shift 3.4 billion US dollars of GDP annually and push 24 million more people into extreme poverty in the next decade. So now AMR in Mycobacterium tuberculosis, malaria parasites, virus, and HIV is becoming a reality that could increase human suffering. It could also deal a huge blow to the world economy due to productivity losses, increased healthcare costs, and a rise in poverty. Even if it is a global crisis, poverty, lack of sanitation, and poor hygiene make AMR worse. Also, AMR disproportionately impacts low-income countries and lower middle-income countries. AMR is those and equity issues too. So now we're going to talk about how One Health approach tackle this AMR issue. Using a One Health approach, it helps design, implement, and monitor programs, policies, and research of AMR surveillance to provide evidence, as also advance intersectoral collaboration between public health, animal, and environment health sectors to achieve better public health outcomes in each of the member states. This proves that AMR need to be taken seriously from all aspects such as human, animal, and environment perspective. Thus, these particular cases is involving One Health. Thank you.
Assalamualaikum warahmatullahi wabarakatuh. My name is Asma Ajila binti Zakaria, matric number 066907. I will present about the effect of antimicrobial resistance for human, animal, and the environment. Antimicrobials is used to prevent or treat the infection of human, animal, and the environment. Antimicrobial resistance also outpaces the development of antibiotic severity, and this can result in common infection becoming too difficult to treat or even untreatable. Also can lead to the longer treatment periods and also longer hospital stay and higher medical costs. Salmonella species that can cause resistance in animal and affect public health through treatment effect when occurring in human. Escherichia coli is the indicator bacteria who always present in environment of animal, food and human. These bacteria have the ability to develop and transmitting the antimicrobial resistance genes. Antimicrobial resistance also can affect the human by increasing the risk of disease spread. Severe illness and mortality also can make organ failure and prolonged care and recovery sometimes needs about a few months to recovery for patient. The effect of antimicrobial resistance on animal health has been given far less attention than that for human health. Similar to human, AMR in animal will lead to suffering or infection that will increase the frequency of treatment failure and increase severity of infection. For owner of food and community production animal, MRR may lead to the financial loss directly to the higher mortality or indirectly reduced production and growth. Also can decrease feed conversion as well as illegal of breeding and production animal. Eventually, this may lead to the higher price of commodity and food from animal production for end consumer. Although the environment and the antimicrobial resistance are strictly linked. The environment is both a vehicle for spreading MR microbes and antimicrobial pollutant, which negatively impact the biodiversity and ecosystem. The impact of antimicrobial pollutant on MRR is environment is complete and necessitated further evidence. The pollution of waterways, soil and air are of course contributing to environment degradation as they are to growing level on antimicrobial resistance. Therefore, environment degradation and pollution factor connected to the triple planetary crisis of climate change, biodiversity loss, the pollution are the very same one of alter microbial diversity and facilitate the development, transmission and diffusion of antimicrobial resistance. We can conclude that antimicrobial resistance in bacterial pathogen is a significant challenge that has a high morbidity and also mortality for both human and animal and also will impact the environment. Health institution, resistant bacteria can be transmitted through contact between patients, by the nursing staff or through contaminated surface and medical device. Resistant bacteria that occur after antibiotic treatment can be transferred from human to an animal. Bacteria can also affect the raw meat and cause the foodborne infection. They can also contaminate in dairy food products, fish and seafood, vegetable and fruit. Tourism and food import is the fast way of spreading resistant bacteria strain across the national border. Resistant bacteria can get into river, lake and groundwater, and the treatment plant eliminate 99% of them in treated wastewater before they discharge the water into the natural environment. The spreading of mineral on cultivated field can also lead to the spread of bacteria which can multiply on plants, seep into the groundwater or be washed into the river and lake.
Assalamualaikum and good day to all. I am Muhammad Ifan Faik bin Junadi. My number matric is 067106 from course SMPKH. Antimicrobial resistance happens when germs like bacteria develop the ability to defeat the drug designed to kill them. That means the germs are not killed and continue to grow, but we can still prevent it. There are many ways to prevent antimicrobial resistance from occurring. First, we can start by preventing the infection from occurring, hence no need to use antibiotic to fight against the infection. Second, we can improve the existing antibiotic that we used before to make them able to kill the bacteria that have developed resistance. For example, using an advanced version of the drug. Third, we should prevent the further spreading of the resistance when the resistance is detected. This can be done by isolating the animal that have developed the bacteria. In conclusion, antibiotics are important for us to fight back infection of bacteria to both human and animals. Most antimicrobial resistance occur when the bacteria develop a way to fight back or resist the antibiotic. Then, these bacteria can increase their population or spread this characteristic to other bacteria. Antimicrobial resistance is not only harmful to animals, it can also cause harm to humans, as the human immune system can kill the bacteria that have developed the AMR. Most cases of AMR are caused by a misuse of antibiotics. Fortunately, there are already many researchers and organizations that try to fight back against this threat. For example, One Health is still fighting against this threat till this day, because One Health's goals are to protect the health of humans, animals, and the environment. The AMR is a threat to humans, animals, and the environment.